And former Chief Justice David Maraga is calling on the Ethics and Anti-Corruption Commission to probe fraud claims at the Social Health Authority. Maraga insists that thorough investigations must be undertaken and those responsible for diverting public funds face justice. And as Stephen Leto reports, Cotu Secretary General Francis Atwoli is also demanding full autonomy for the authority to operate independently.
Former Chief Justice David Maraga is raising the red flag over questionable payments made to hospitals for the month of August. Maraga is now urging the Ethics and Anti-Corruption Commission to step in and conduct a full investigation into the matter.
We call upon EACC to carry out investigations and prosecute all those involved. Monies lost must be recovered and those responsible must be prosecuted and not protected.
Maraga wants all officials serving under the Social Health Authority, including those managing the payment system, to be probed as a matter of urgency.
Those who have colluded to defraud Kenyans must also face the full force of the law.
The Central Organization of Trade Unions, Cotu, on its part is demanding that Kenya's Social Health Authority be granted full autonomy over its IT systems. In a statement on Tuesday, Cotu Secretary General Francis Atwoli said he cannot explain to workers what is happening at SHA, arguing that the authority has been reduced to a mere conveyor belt for processing payments, yet it does not have control of the IT system meant to fix problems left behind by the defunct NHIF. The statement adds that it is even more disturbing that despite SHA having its own independent board mandated by law, an amorphous entity DHA, the Digital Health Authority, together with the Ministry of Health, continue to sideline it and force it into a secondary role. Cotu says loopholes at the SHA exist because the authority cannot verify or authenticate claims, nor determine who should or should not be paid. Cotu is warning that unless SHA is granted full control of its IT platform, workers will lose trust and confidence in the institution, jeopardizing compliance and service delivery. Health Cabinet Secretary Aden Duale says SHA claims worth 3 billion shillings are under re-evaluation due to missing documents, while another 2.1 billion shillings remains under surveillance for further investigations. Duale added that the ministry has rejected 10.6 billion shillings in claims, citing fraudulent practices, including upcoding, falsification of medical records, converting outpatient cases into inpatient admissions, and phantom billing for non-existent patients. Deputy President Professor Kithure Kindiki defended SHA, saying unlike the defunct NHIF, SHA is effectively detecting fraud, adding that while NHIF fell on fraud, SHA will rise on its ability to detect and prevent fraudulent claims. Stephen Leto, Citizen TV.